Hello everyone, welcome back to Nclex Made Easy 91. Today, we'll be going through endocrine system Nclex style questions with detailed rationales. This session is designed to sharpen your test-taking skills, help you understand the why behind each answer, and prepare you for success in your exams. So grab your notes and let's dive right into these high-yield practice questions. Question 1. A nurse is assessing a client with a suspected endocrine disorder. The nurse notes that the client has a moon face, exophthalmos, and edema. Which of the following endocrine glands may be the source of this client's disorder? A. Parathyroid gland. B. Adrenal cortex. C. Pineal gland. D. Pancreas. Correct answer, B. Adrenal cortex. Rationale. The physical characteristics of a moon face, exophthalmos, and edema can indicate a disorder of the thyroid, adrenal cortex, or pituitary gland. The provided information lists these signs as part of a physical assessment for endocrine disorders. The parathyroid gland is involved in calcium regulation, the pineal gland and sleep cycles, and the pancreas and blood glucose control, none of which are directly associated with this specific cluster of physical findings. The combination of moon face, exophthalmos, and edema makes the adrenal cortex a plausible source. Strategy. This question requires recognizing a cluster of physical findings and associating them with a specific endocrine gland as outlined in the physical assessment section. The key is to connect the specific signs, moon face, exophthalmos, and edema, to the glands listed as potential sources, thyroid, adrenal cortex, or pituitary gland. Eliminate options that are not linked to these physical signs in the provided text. Question 2. A nurse is reviewing a client's laboratory results. The serum cortisol level is 25 micrograms per deciliter at 8 a.m. Which of the following conditions is most consistent with this result? A. Addison's disease. B. Diabetes insipidus. C. Cushing syndrome. D. Hypopituitarism. Correct answer, C. Cushing syndrome. Rationale. The normal adult value for serum cortisol at 8 to 10 a.m. is 5 to 23 micrograms per deciliter. A client's result of 25 micrograms per deciliter is elevated, which is consistent with Cushing syndrome, a condition associated with increased cortisol levels. Decreased cortisol levels, on the other hand, are seen in Addison's disease. Strategy. To answer this, you must recall the normal lab values for specific hormones. The question provides a morning cortisol level and asks for the associated condition. By comparing the client's value, 25 micrograms per deciliter, to the normal range, 5 to 23 micrograms per deciliter, you can determine that the value is elevated. The information explicitly states that increased cortisol levels are indicative of Cushing syndrome. So, answer B. Question 3. A client is diagnosed with diabetes insipidus. Which of the following is the highest priority nursing intervention for the client? A. Administering a low-sodium diet and diuretics. B. Monitoring for signs of water intoxication. C. Providing adequate fluids to prevent dehydration. D. Preparing the client for a hypoxectomy. Correct answer, C. Providing adequate fluids to prevent dehydration. Rationale. The nursing care of a client with diabetes insipidus focuses on managing fluid and electrolyte problems. A key intervention is to provide adequate fluids to prevent dehydration because the condition leads to the excretion of large volumes of dilute urine. While monitoring for water intoxication is important, it is a potential side effect of treatment, vasopressin, not the primary goal of care for the condition's main symptoms. Diuretics and a low-sodium diet are not the main treatment for this condition, and a hypoxectomy is a surgical treatment, not an immediate nursing priority. Strategy. This question requires prioritizing nursing interventions. The core problem in diabetes insipidus is a risk of dehydration due to polyuria. Therefore, the most critical intervention is to manage fluid balance. Look for the intervention that directly addresses the primary symptom. Other options may be part of the overall care plan, but are not the top priority. Question 4. Which of the following hormones is secreted by the pineal gland and is responsible for regulating sleep patterns? A. Thyroxine. B. Oxytocin. C. Melatonin. D. Vasopressin. Correct answer, C. Melatonin. Rationale. The pineal gland secretes the hormone melatonin, which is responsible for regulating sleep patterns. Thyroxine is a thyroid hormone, oxytocin is from the posterior pituitary, and vasopressin is also from the posterior pituitary. Strategy. This is a direct recall question. The strategy is to carefully match the hormone to its secreting gland as mentioned in the anatomic and physiologic overview section. Read each option and cross-reference it with the information to confirm its function and origin. Question 5. A nurse is providing care for a client with mixed edema coma. The nurse should be aware of the client's increased sensitivity to which of the following medications? A. Diuretics. B. Vasopressin. C. Narcotics and barbiturates. D. Synthetic levothyroxine. Correct answer, C. Narcotics and barbiturates. Rationale. The provided information states that patients with hypothyroidism, particularly in its severe form like mixed edema coma, have an increased sensitivity to narcotics and barbiturates. This sensitivity makes these medications a precipitating factor for mixed edema coma and requires careful monitoring. Synthetic levothyroxine is the treatment for hypothyroidism, not a substance to which the patient is sensitive.
Question 6. A client with hyperthyroidism undergoes a physical examination. The nurse expects to find which of the following? A. Bradycardia. B. Hypotension. C. Weight gain. D. Fine tremor of the fingers and tongue. Correct answer, D. Fine tremor of the fingers and tongue. Rationale. The clinical manifestations of hyperthyroidism include an increased heart rate and force of cardiac contractions, leading to tachycardia. The client would also experience weight loss despite an increased appetite. Nervous system symptoms include nervousness and a fine tremor of the fingers and tongue, among others. Strategy. This question asks about the expected clinical manifestations of hyperthyroidism. The strategy is to recall the effects of an increased metabolic rate on the body. Symptoms like increased heart rate, tachycardia, not bradycardia, and weight loss are common. The information explicitly lists fine tremor of finger and tongue as a nervous system manifestation. This makes it the most accurate answer. Question 7. A nurse is preparing a client for a water deprivation test. A positive result, which indicates an increased level, points to which of the following conditions? A. Diabetes insipidus. B. Syndrome of inappropriate antidiuretic hormone, SIADH. C. Hypothyroidism. D. Adrenal insufficiency. Correct answer, B. Syndrome of inappropriate antidiuretic hormone, SIADH. Rationale. The information states that a water deprivation test is used to evaluate for SIADH and diabetes insipidus. It specifically mentions that an increased level indicates SIADH, decreased level means diabetes insipidus. Therefore, a positive result, increased level, is consistent with SIADH. Strategy. This is a direct recall question about a specific diagnostic test. The key is to remember which condition is associated with an increased versus a decreased level in the water deprivation test. The information explicitly provides this information. Question 8. A client with acromegaly is being assessed. The nurse would expect to find which of the following physical changes? A. Short stature. B. Decreased size of hands and feet. C. A deepening of the voice. D. Thin extremities. Correct answer, C. A deepening of the voice. Rationale. Acromegaly is a condition caused by an excess of growth hormone, GH, in adults. The information lists several clinical manifestations, including changes in facial features, increased size of hands and feet, and a deepening of voice from thickening of vocal cords. It also mentions that it does not cause an increase in height, but rather bone and soft tissue deformities and enlargement of viscera. Thin extremities and short stature are associated with other conditions such as hypopituitarism and dwarfism. Strategy. The question asked for a specific physical manifestation of acromegaly. The strategy is to scan the text for the term acromegaly and then locate the list of associated clinical manifestations. You must distinguish between the effects of excess GH in adults and children and identify the correct physical changes listed in the information. Question 10. A nurse is providing post-operative care for a client who underwent a transsphenoidal hypophysenectomy. The nurse should be most concerned about which of the following potential complications? A. Hyperglycemia. B. Diabetes insipidus. C. Hypokalemia. D. Exophthalmos. Correct answer, B. Diabetes insipidus. Rationale. The transsphenoidal approach is used for the surgical removal of pituitary tumors. A common disorder of the posterior pituitary lobe dysfunction is diabetes insipidus, which can be caused by the surgical removal of the pituitary gland. Therefore, a client who has had a hypophysenectomy is at risk for developing diabetes insipidus. Strategy. This question links a surgical procedure to a potential complication. The key is to understand the function of the pituitary gland and how its removal would affect the body. Since the posterior pituitary stores and releases vasopressin, ADH, its surgical removal or trauma can lead to deficient vasopressin production, causing diabetes insipidus. The other options are not as directly linked as a postoperative complication of this specific surgery. Question 10. A nurse is educating a client with Graves' disease about their medication regimen. The nurse explains that propranolol, Enderol, is used as adjunctive therapy for which purpose? A. To inhibit the synthesis of thyroid hormone. B. To inhibit the release of thyroid hormone. C. To provide symptomatic relief. D. To permanently cure the disease. Correct answer, C. To provide symptomatic relief. Rationale. The information states that beta blockers such as propranolol are used as adjunctive therapy for symptomatic relief in hyperthyroidism. Antithyroid medications like propionthiouracil, PTU, and methimazole inhibit hormone synthesis. Iodides, such as radioactive iodine, primarily inhibit the release of thyroid hormone. Surgery is used to remove the gland, which can be a more permanent solution than medications.
Strategy. This question requires differentiating the function of various medications used to treat hyperthyroidism. The term adjunctive therapy is a key phrase. You need to identify which drug class, beta blockers, antithyroid drugs, or iodides, performs which function. The information explicitly states that propranolol provides symptomatic relief. Question 11. A nurse is reviewing the diagnostic procedures for a client with a suspected endocrine disorder. Which of the following tests is used to differentiate between a hypothalamic and a pituitary cause of a specific hormonal deficiency? A. Insulin tolerance test. B. Dexamethasone suppression test. C. Gonadotropin-releasing hormone, GnRH stimulation test. D. Water deprivation test. Correct answer, C. Gonadotropin-releasing hormone, GnRH stimulation test. Rationale. The GnRH stimulation test is used to differentiate between hypothalamic and pituitary causes of hypogonadism. The insulin tolerance test is used to assess growth hormone and ACTH reserve. The dexamethasone suppression test is used to screen for Cushing syndrome. The water deprivation test is used to evaluate for diabetes insipidus. Strategy. This is a direct recall question that tests your knowledge of specific diagnostic tests and their purposes. The key is to match the test name with its function as described in the review of diagnostic procedures. Read through the test descriptions and find the one that explicitly mentions differentiating between hypothalamic and pituitary issues. Question 12. A client with Addison's disease is admitted to the hospital. The nurse should prioritize monitoring for which of the following electrolyte imbalances? A. Hyperkalemia and hyponatremia. B. Hypernatremia and hypokalemia. C. Hypercalcemia and hypophosphatemia. D. Hyperglycemia and hypernatremia. Correct answer A. Hyperkalemia and hyponatremia. Rationale. Addison's disease is characterized by a deficiency of adrenal cortical hormones. This leads to a decrease in excretion of potassium and an increase in excretion of sodium, resulting in hyperkalemia and hyponatremia. The management of Addison's disease includes a diet high in sodium and fluids to address the sodium loss and prevent hypotension. Strategy. This question requires you to connect the pathology of Addison's disease to the resulting electrolyte imbalances. You must remember the function of adrenal hormones, specifically aldosterone, which regulates sodium and potassium balance. A deficiency in aldosterone leads to a retention of potassium and a loss of sodium. Question 14. A client with diabetes mellitus is scheduled for a glucose tolerance test. The nurse should provide which instruction to the client prior to the test? A. Eat a meal high in carbohydrates the day before the test. B. Fast for at least 8 hours before the test. C. Take their usual insulin dose on the morning of the test. D. Avoid all physical activity for 24 hours before the test. Correct answer, B. Fast for at least 8 hours before the test. Rationale. The instructions for a glucose tolerance test require the client to fast overnight for 8 to 12 hours before the test. They should also not drink coffee, tea, or smoke on the morning of the test. These restrictions are necessary to ensure an accurate baseline blood glucose level. The other options are incorrect based on the standard procedure for this test. Strategy. This is a procedural question about patient preparation for a diagnostic test. The strategy is to recall the specific pre-test instructions for a glucose tolerance test. The fasting requirement is a key component of this test. Question 14. A nurse is providing care for a client with hyperparathyroidism. The nurse understands that this condition is most likely to lead to which of the following complications? A. Hypocalcemia. B. Renal calculi. C. Bone density increase. D. Hypophosphatemia. Correct answer, B. Renal calculi. Rationale. Hyperparathyroidism leads to an overproduction of parathyroid hormone, which causes an increase in serum calcium levels, or hypercalcemia, and a decrease in serum phosphate levels, or hypophosphatemia. The increased calcium levels can result in the formation of renal calculi, or kidney stones, due to the excess calcium being excreted by the kidneys. While hypophosphatemia is a finding in this condition, it is not a complication in the same way as renal calculi. Strategy. This question asks for a direct complication of a specific endocrine disorder. The strategy is to trace the physiological effects of hyperparathyroidism. An overproduction of parathyroid hormone leads to increased blood calcium. The most significant complication of this hypercalcemia is the formation of kidney stones. Question 15. Which of the following hormones secreted by the posterior pituitary is also known as antidiuretic hormone, or ADH, and is crucial for maintaining water balance? A. Thyroid stimulating hormone, TSH. B. Growth hormone, GH. C. Vasopressin. D. Prolactin. Correct answer, C. Vasopressin. Rationale. The posterior pituitary secretes two hormones, one of which is vasopressin, also known as antidiuretic hormone, or ADH, which is crucial for maintaining water balance. TSH and GH are secreted by the anterior pituitary, and prolactin is also from the anterior pituitary. Strategy. This is a direct recall question about the hormones of the posterior pituitary. The strategy is to match the hormone name with its alternative name, ADH, and its function.
Question 16. A client with a thyroid disorder presents with signs of an acute thyroid storm. The nurse would anticipate administering which of the following medications to block thyroid hormone release? A. Radioactive iodine, RAI. B. Propylthiouracil, PTU. C. Propranolol. D. Iodides. Correct answer, D. Iodides. Rationale. Iodides, such as potassium iodide or Lugol's solution, are used to block the release of thyroid hormones from the thyroid gland. This makes them a key component of the treatment for thyroid storm, where a rapid reduction of circulating hormones is necessary. Radioactive iodine is used for permanent ablation of the thyroid gland. PTU and methizamol inhibit hormone synthesis, and propranolol provides symptomatic relief. Strategy. This question requires you to know the specific function of different antithyroid medications. The term thyroid storm implies an emergent situation. You must identify the medication class that rapidly stops the release of stored thyroid hormones, which is the role of iodides. Question 17. The function of the adrenal cortex is primarily to secrete which class of hormones? A. Catecholamines. B. Steroids. C. Peptide hormones. D. Melatonin. Correct answer, B. Steroids. Rationale. The adrenal cortex secretes steroid hormones. This includes three types: glucocorticoids, example cortisol, mineralocorticoids, example aldosterone, and sex hormones. Catecholamines, epinephrine and norepinephrine, are secreted by the adrenal medulla. Peptide hormones and melatonin are secreted by other glands and have different functions. Strategy. This question tests your knowledge of the different parts of the adrenal gland and the types of hormones they secrete. The key is to recall the primary function of the adrenal cortex. The key is to associate the adrenal cortex with the production of steroids. Question 18. A client with SIADH is providing care to a client with a nurse is providing care to a client with SIADH. The nurse should be aware of the risk of which of the following complications? A. Hyperglycemia. B. Fluid volume deficit. C. Seizures. D. hypernatremia. Correct answer, C, seizures. Rationale. Syndrome of inappropriate antidiuretic hormone, SIADH, is characterized by fluid retention and dilutional hyponatremia, low sodium levels. Severe hyponatremia can lead to serious neurological complications, including confusion, lethargy, muscle weakness, and in severe cases, seizures and coma. Therefore, seizures are a major risk and a priority to prevent. Strategy. This question requires you to understand the pathophysiology of SIADH. The key is to connect the primary problem, excess ADH leading to fluid retention and dilutional hyponatremia, to its most dangerous complication. A low serum sodium level has a direct impact on neurological function, making seizures a critical concern. Question 19. What is the primary diagnostic finding in a client with mixed-cell edema? A. Decreased thyroid-stimulating hormone, TSH. B. Increased T3 and T4 levels. C. Elevated free T4 levels. D. Decreased T3 and T4 levels. Correct answer, D. Decreased T3 and T4 levels. Rationale. Mixed edema is a severe form of hypothyroidism. Diagnostic tests for hypothyroidism show decreased T3 and T4 levels. The TSH level would be elevated in primary hypothyroidism as the pituitary gland tries to compensate for the low thyroid hormone levels. Strategy. This question requires you to know the laboratory findings associated with a specific endocrine disorder. The strategy is to match the condition, mixed edema, a form of hypothyroidism, with the expected lab results. Remember that in primary hypothyroidism, T3 and T4 are low and TSH is high. Question 20. A nurse is teaching a client about the role of the pancreas in blood glucose regulation. The nurse should explain that the pancreas secretes which two hormones that have opposing effects? A. T3 and T4. B. Insulin and glucagon. C. Vasopressin and oxytocin. D. Aldosterone and cortisol. Correct answer, B. Insulin and glucagon. Rationale. The pancreas is responsible for regulating blood glucose. It secretes two important hormones, insulin and glucagon, which have opposing actions. Insulin decreases blood glucose and glucagon increases it. The other pairs of hormones are secreted by different glands and have different functions. Strategy. This is a fundamental knowledge question about the function of the pancreas. The strategy is to recall the main hormones involved in blood sugar regulation. The key is to identify the pair of hormones that have a direct and opposing effect on blood glucose levels.
Question 21. A nurse is reviewing a client's plan of care for diabetes insipidus. Which of the following is an expected therapeutic outcome of the treatment? A. Increased urine output with a higher specific gravity. B. Decreased thirst and increased fluid intake. C. Decreased serum osmolarity and increased urine output. D. Decreased urine output and decreased thirst. Correct answer, D. Decreased urine output and decreased thirst. Rationale. Diabetes insipidus is characterized by polyuria, which is excessive urination, and polydipsia, excessive thirst, due to a deficiency in ADH. The therapeutic goal of treatment is to correct these symptoms. Therefore, a successful outcome would be a reduction in both urine output and thirst, indicating that fluid balance is being restored. Strategy. The question asks for a therapeutic outcome. You need to identify the primary symptoms of diabetes insipidus, polyuria, and polydipsia, and then determine which of the options represents the successful reversal of these symptoms. Decreased urine output and decreased thirst directly address the core problems of the condition. Question 22. Which of the following hormones is secreted by the adrenal medulla in response to stress? A. Cortisol. B. Aldosterone. C. Epinephrine. D. Androgens. Correct answer, C. Epinephrine. Rationale. The adrenal medulla is responsible for secreting catecholamines, such as epinephrine and norepinephrine, which are released during the fight or flight response to stress. Cortisol, aldosterone, and androgens are steroid hormones secreted by the adrenal cortex. Strategy. This is a direct recall question about the function of a specific part of the adrenal gland. The key is to distinguish between the adrenal cortex and the adrenal medulla, and to remember which hormones each part secretes. Epinephrine is the primary hormone associated with the adrenal medulla's stress response. Question 23. A client is experiencing signs of hypoglycemia. The nurse should be prepared to administer which of the following? A. A long-acting insulin. B. Glucagon. C. Metformin. D. A sodium-rich meal. Correct answer, B. Glucagon. Rationale. Hypoglycemia is a state of low blood glucose. Glucagon is a hormone that has the opposite effect of insulin. It stimulates the liver to release stored glucose, thereby raising blood sugar levels. Administering a long-acting insulin or metformin would further decrease blood glucose and worsen the condition. A sodium-rich meal is not the appropriate intervention for low blood sugar. Strategy. This is a question about a rapid intervention for a common endocrine emergency. You need to know the primary treatment for hypoglycemia. The key is to identify the substance that will quickly increase blood glucose. Glucagon is the correct choice as it directly counteracts the effects of insulin. Question 24. A client with history of Graves' disease who has developed a goiter. The nurse understands that the goiter is a result of A. Decreased TSH levels. B. Hypocalcemia. C. Increased stimulation of the thyroid gland. D. Hyposecretion of thyroid hormones. Correct answer, C. Increased stimulation of the thyroid gland. Rationale. A goiter is enlargement of the thyroid gland. In Graves' disease, which is a form of hyperthyroidism, the immune system produces an antibody that mimics TSH, leading to the excessive stimulation of the thyroid gland. This constant stimulation causes the gland to enlarge, resulting in a goiter. Strategy. This question requires you to connect a clinical manifestation, goiter, to its underlying cause in a specific disease, Graves' disease. The key is to understand the pathophysiology of Graves' disease, which is an overstimulation of the thyroid gland. This process leads to both hypersecretion of hormones and the physical enlargement of the gland. Question 25. A client with Cushing syndrome is being assessed for fluid balance. Which of the following findings would be most consistent with the condition? A. Weight loss and muscle wasting. B. Hypertension and fluid retention. C. Hypoglycemia and hyponatremia. D. Hyperkalemia and metabolic acidosis. Correct answer, B. Hypertension and fluid retention. Rationale. Cushing syndrome is characterized by an excess of glucocorticoids, like cortisol, and mineralocorticoids, like aldosterone. The excess aldosterone leads to sodium and water retention, which results in hypertension and fluid retention. Other symptoms include weight gain, not loss, muscle wasting, and hyperglycemia, not hypoglycemia. Strategy. This question asks for a specific clinical manifestation of Cushing syndrome. The strategy is to recall the effects of excess adrenal hormones, particularly the mineralocorticoids. Excess aldosterone leads to the retention of sodium and water, which directly causes fluid retention and hypertension. Question 26. A nurse is providing care for a client following a total thyroidectomy. The nurse should prioritize monitoring for which of the following potential complications? A. Tachycardia and fever. B. Signs of hypocalcemia. C. Hyperglycemia and polyuria. D. Fluid volume overload. Correct answer is B. Signs of hypocalcemia. Rationale. During a total thyroidectomy, the parathyroid glands, which are located near the thyroid, may be accidentally removed or damaged. The parathyroid glands are crucial for regulating calcium levels. The removal or damage can lead to a deficiency in parathyroid hormone, PTH, resulting in hypocalcemia. Symptoms of hypocalcemia include tingling, numbness, muscle twitching, and in severe cases, tetany. Strategy. This question is about post-operative care following a specific surgery. You must remember the anatomical relationship between the thyroid and parathyroid glands. The most significant post-operative risk related to the parathyroid glands is hypocalcemia, making it the highest priority to monitor. Question 27. Which of the following is a classic triad of symptoms for diabetes mellitus? A. Polyphagia, polydipsia, and polyuria. B. Polydipsia, polyuria, and blurred vision. C.
polyuria, polyphagia, and weight gain. D. Weight loss, hypertension, and polydipsia. Correct answer is A. Polyphagia, polydipsia, and polyuria. Rationale. The classic clinical manifestations of diabetes mellitus are the 3 Ps: polyphagia, increased hunger; polydipsia, increased thirst; and polyuria, increased urination. These symptoms are a direct result of the body's inability to properly utilize glucose. Strategy. This is a fundamental knowledge question about a common condition. The 3 Ps are a classic mnemonic. The key is to remember the 3 correct symptoms that form the triad. Other options contain symptoms that may be associated with diabetes, but they do not form the classic triad. Question 28. A nurse is educating a client with Addison's disease about their medication regimen. The nurse explains that fludrocortisone, Florinef, is a mineral corticoid used to replace which missing hormone? A. Cortisol. B. Aldosterone. C. Epinephrine. D. Glucagon. Correct answer is B. Aldosterone. Rationale. Fludrocortisone, Florinef, is a mineral corticoid, and its primary purpose in the treatment of Addison's disease is to replace the deficient mineral corticoid, aldosterone. Aldosterone is essential for regulating sodium and potassium balance. Cortisol, a glucocorticoid, is replaced by other medications like hydrocortisone. Strategy. This question requires specific knowledge of medication classes and their functions in hormone replacement therapy. The term mineral corticoid in the question is a major clue. You must know that aldosterone is the key mineral corticoid that is deficient in Addison's disease and is replaced by a drug like fludrocortisone. Question 30. The parathyroid glands primarily regulate the levels of which 2 electrolytes in the body? A. Sodium and potassium. B. Calcium and phosphate. C. Chloride and magnesium. D. Glucose and insulin. Correct answer is B. Calcium and phosphate. Rationale. The primary function of the parathyroid glands is to secrete parathyroid hormone, PTH, which plays a crucial role in regulating serum calcium and phosphate levels. PTH increases calcium levels by stimulating bone resorption and reabsorption in the kidneys, while it decreases phosphate levels. Strategy. This is a direct recall question about the function of the parathyroid glands. The key is to remember which 2 electrolytes are primarily controlled by these glands. The relationship between calcium and phosphate is the central concept. Question 30. A client with hyperthyroidism is being treated with radioactive iodine, RAI. The nurse should provide which of the following instructions? A. You will need to be in isolation for the next 24 hours. B. The treatment will have an immediate effect on your symptoms. C. You will need to take this medication for the rest of your life. D. This treatment is a cure and you will not need any follow-up. Correct answer is A. You will need to be in isolation for the next 24 hours. Rationale. Radioactive iodine, RAI, is absorbed by the thyroid gland and destroys the overactive thyroid cells. Because the client is radioactive for a period after the treatment, they must take precautions to avoid exposing others. The information states that clients must be isolated from others, particularly pregnant women and children, for a period after treatment. The effect is not immediate, and the client will need follow-up to monitor for hypothyroidism, which is a common side effect requiring lifelong hormone replacement. Great job making it through these endocrine system review questions. Remember, practice is key to mastering Nclex style exams, and understanding the rationales will give you the confidence to answer similar questions in the real test. If you found this video helpful, don't forget to like, share, and subscribe for more nursing review content. Drop a comment below with the topic you'd like me to cover next. Thanks for watching, and until next time, keep studying.